COVID cases and staffing struggles caused a Twin Cities assisted living facility to call on family members to care for their loved ones. WCCO's Liz Collin explains how an outbreak in Watertown sent some residents to new addresses and the larger care crisis facing facilities all across the state.
This has been our first outbreak. We've had one positive test in this long.
The director of Westwood Place in Watertown didn't expect COVID to finally creep in. 9 of their 24 residents, all vaccinated and boosted, tested positive over the holidays. So did nearly a third of the facility's staff.
You're recovering from COVID too.
Yes, correct.
Cindy Clarence called it a last resort, but said with so many out sick, they had no choice but to have families take in their relatives who don't have the virus for at least the next week. So far, 4 residents have left.
Just to get some of them maybe home with their loved ones, it just helped alleviate the stress off of them, as well as my team members that are presently there.
It's not a question of if, it's usually a question of when for this particular variant. And if you're quarantining for 5 days and all of your other colleagues are quarantining for 5 days, there is no one left.
As president of Care Providers of Minnesota, Patty Cullen is watching this same scenario play out across the state. She says nursing facilities have more state help, like the National Guard as an option. In assisted living settings, a temporary move may be all that's left.
Anytime you move a senior, there's trauma. You don't want to do that, but you also have to give them services.
After holiday gatherings, Cullen believes the next few weeks will be the most telling on what happens next, as communities like Watertown take it day by day to get people the care they need.
I'm just hoping it's going to run its course and not be back for a long time.
Liz Collin, WCCO 4 News.
None of the COVID cases at Westwood Place is considered to be serious. Right now, 30% of the state's assisted living facilities are not taking any new clients due to the pandemic. In long-term care settings, that number rises to more than 70%.